My name is Joseph Ollayos. I'm the administrator at Tri-Cities Surgery Center in Geneva, Illinois. It's a hospital physician joint venture. The facility has 5 rooms, 2 ORs and 3 GI labs. And our current case mix is about 90% GI procedures and cataract surgery. So we focus on a lot of small, quick turnover cases. We saw our first patients in May of 2007, so we just celebrated our 4th anniversary. And in that time, we've ramped up to where in the last 12 months, we've done just over 5,400 procedures. Well, in terms of our physician component, we have a fairly large staff. It's just over 70 physicians. But when we took a look at our physician utilization statistics for the past year, we have 10 doctors that are producing between 75 and 80% of our caseload. So it's really an 80-20 type of principle where we've got a core group that provides most of our production, and then a number of other physicians, most of them non-investors, who come occasionally for certain cases. Most of the decisions we made subsequent to that were operational matters that involved either building libraries and tables for how we wanted the workflow of the surgery center to go, and the other big decision was choosing the clearinghouse for our billing, and we went with Zirmed, which is the business partner for Source Medical. When we went into this, we had 3 or 4 key priorities that we had identified. The first one, of course, was the management of our revenue cycle, knowing that that was the cash flow of the surgery center. We also had a keen interest in the whole scheduling, workflow, clinical piece, knowing that the scheduling system is really the gatekeeper to the entire surgery center, and that to successfully perform and manage, turn over these cases, we were going to need good inventory management, preference cards, some of the things that go with that. Third was the inventory management piece, knowing that those medical supplies after labor are the 2nd largest cost component of the surgery center. Probably the 4th one had to do with what I would nickname regulatory compliance, knowing that the Illinois Department of Public Health has several detailed reports that they require the surgery center to produce, and we were relying on Source Medical to be able to format and transmit those electronic files. The priorities that we set were met. In terms of finding the right solution and partner, we were led to Source Medical by our project manager. So vision was really something that we had essentially latched onto right away. I'd actually been a Source Medical client for 7 years before that on their Surgisource platform, and it was good software, had great reports, we got good support from their help desk, and so we had a pretty good level of confidence when we went in with vision that we were going to have that same success. Well, one of the big challenges we had was picking the correct clearinghouse, since there were several options that were presented to us at the time. After an analysis, we chose Zirmed. Source Medical later announced that they were going to be the key clearinghouse partner, and so we feel like we guessed right. One of the big challenges that Source Medical helped us with was our case costing. We have some very limited reimbursement in several areas, and so the information that comes out of the system regarding labor and supply cost was instrumental in us being able to manage those cases and make some decisions about which ones that we could take and perform profitably at the center and which ones that we could not. In terms of the billing and collection system, of course, there was the whole matter of entering the claims data, getting those off to the clearinghouse, and the Source Medical trainers were really instrumental in showing us how to do that and adjust our workflow so that it was efficient and that it reduced the number of errors and ultimately, for the billing, the claim denials. We would recommend Source Medical to another center based on our experience, which has been a success in terms of being able to set up and run the practice management system for the surgery center, and also based on some of the support that we've gotten from the help desk.